Live from the KHOU11 studios, it's Great Day Houston.
Welcome back. When our hormones are off balance, so is the rest of our body. Dr. Hotze with the Hotze Health and Wellness Center stopped by recently to explain how that opens the door to diseases like breast cancer. Dr. Hotze, so many times people think that breast cancer is about DNA, when in reality, it's about more than that.
Right. 85% of people who develop breast cancer have no family history of breast cancer. Although a woman who's born to whose mother had breast cancer is twice the incidence of getting breast cancer. Yeah. But overall, the cause of breast cancer can be broken down. It could be genetic. It's a small percentage of the cases it is. But it can be due to, and what the real problem is hormonal imbalances that occur in women's lives as they march through their menstrual life in their 30s and 40s. We see the incidence of breast cancer increasing as a woman moves past the age of 40. Up to 60, we see a rise in the incidence of breast cancer, and that's when her progesterone levels have fallen, and that's very important. Chemicals in the environment can cause breast cancer. Radiation, mammograms have been shown to increase, if you get radiated every year for mammograms, well, you're going to increase your risk of breast cancer.
You're not a big fan of mammograms, but there are a lot of women who say that's how they found their tumor.
Well, you can find it. But, but you also put yourself at a risk by having the mammograms. That's why there was that big controversy several years back about, from all the way in the federal government and the physicians saying, maybe we need to cut back on the mammograms. But there was such
backlash.
Yeah, such a backlash for the people that had the mammograms that wanted to do mammograms. It was a financial deal. We don't want to cut back on mammograms. That's how we make our money. So there was a big argument about that. Yeah. But I think safety-wise, less mammograms are safe. At our center, we use thermograms, so we measure the breast heat off the breast so we don't put ionizing radiation, because we know ionizing radiation increases the risk of all kinds of cancer, so we don't want to do that. But let's go back to the hormonal problem.
Right.
This is where the real problem occurs.
Because a lot of people think that the hormonal imbalance, basically it's about moodiness and that's it. It's about so many things, right. Your immune system and overall health.
Well, so it can be your own natural imbalance of your own hormones can cause it. That's when your progesterone levels fall. Progesterone is the hormone of the second half of the month. There was a study done in 1981 published in the Journal of American Epidemiology by the Johns Hopkins School of Public Health, which discussed progesterone, and individuals that had low levels of progesterone were shown to have an increase of breast cancer of 540%, and of all cancers 1,000%. And this is if they had low progesterone levels, and they studied 20,000 different women over a 20 years period. So progesterone decline increases your risk of breast cancer. So when does progesterone decline? It declines by the time a woman hits her 30s, she starts having the decline.
So the door is opening.
And how do you know you have the decline? Because that's when women start having the premenstrual symptoms, the breast tenderness, the mood swings, fluid retention, weight gain, migraine, headaches that start a couple of days before the period, then may last a week or 2 weeks before the period. That's a sign of progesterone deficiency. So that should be replenished as soon as a woman has the symptoms, not when she's 50, because when she's 50, her progesterone levels are lower, and she's already increased her. She's been exposed and increased the risk. Now, the other problem is the counterfeit hormones. We talked about the Premarin.
Yeah, because you deal with bioidentical, right. But there's Premarin and things like oral contraceptives.
Right. Oral contraceptives are counterfeit drugs that mimic hormones. And there have been studies. Some studies say they increase the risk of breast cancer. Other studies say they don't. I know this. It cuts off the production of progesterone, which protects against breast cancer. So birth control pills have a host of side effects and deleterious side effects, and they try to say, well, they're safer than pregnancy. I don't think anything's safer than something that's natural. A chemical drug you put in your body to suppress a natural function is not going to be intuitively, you know, it's not safer. Yeah. I mean, yeah. Just by reasoning, you know, it's not going to be safer. So it's the counterfeit hormones, the birth control pills that should be eliminated, really, and you should be on bioidentical hormones as soon as you begin to have symptoms of hormonal decline and hormonal decline and hormonal
Now, when you say symptoms, a lot of people we're stuck to a test. We rely on a test as opposed to the symptoms.
Well, the blood tests on hormones are always going to show you usually 95% of the time within the range, because that's how they define the range. But in a woman's hormones, they fluctuate throughout the whole month, so it just depends when you draw the hormones. So there's this broad range of normal. When women,
and a lot of women will go in saying, I don't feel good, and someone will say, well, the test says you should feel good.
Right. And so what they end up doing, the doctor ends up putting you on a host of pharmaceutical drugs, the antidepressants and a host of sleep medication, anti-anxiety medication, anti-inflammatory medication.
Meanwhile, the problem marches on.
Right. When the real problem was the decline and imbalance in the hormones. It's very simple to replenish the hormones and balance them out if you work with physicians who are experienced in dealing with female hormones or male hormones.
All right, and your recommendation is basically, to sum it up, chemical toxicity is a major risk factor, so make sure you can reduce that. Eat a healthy diet. We can't say this one enough, and I think we've all heard this over and over and over again, but it's harder to do than a lot of us realize. But your point, and at your center, what I love is you make the patient a partner, and you sign a contract. You make them a partner in their health, and it may be hard to do, but if you want to live a healthy life, you got to do it. The others incorporate exercise into your daily routine, not to be underestimated.
No, all those are important. And again, let me emphasize, it's so important to replenish and balance your hormones as you march through your menstrual life. That's so very important. And let me mention something else. There was, back in the 1960s, the incidence of cancer was 1 in 20. Incidence of cancer now is 1 in 8.
What's the difference?
Well, I think it's because that's when we had the birth control pills and the Premarin and all these counterfeit hormones. Now the Women's Health Initiative, we've had a decrease in breast cancer here recently because women aren't taking the Premarin anymore, and they're not taking the counterfeit hormones. And it's been shown, or at least a study in our facility, using bioidentical hormones, we have a lower incidence of breast cancer than the population at large.
Amazing. Dr. Hotze, thank you very much for giving us a little education on that, so we can help our body do what it does best.
And Dr. Hotze brought a copy of his new Hypothyroidism Health and Happiness book for everyone in our studio audience here. And for those of you at home, you can order your free copy from thyroidanswer.com/GDH, but you must pay shipping and handling. The Hotze Health and Wellness Center will be hosting a complimentary webinar on breast cancer prevention October 28th at noon. Visit HotzeHWC.com to register, and to make an appointment with the Hotze Health and Wellness Center, call 281-698-8698, 281-698-8698. All right, so see, when you come to the show, you actually get things. Well, you've probably heard of ADHD, but do you really know what it involves? And how do you help a child diagnosed?